Mr. Aminul Islam Sujon. He is working on tobacco control and NCD preventions for about 20, more than 2 decades. So he was involved with the civil society organizations in Bangladesh, that is BATA, Bangladesh Anti-Tobacco Alliance, since it was founded in 1999, and produced various publication, quarterly newsletter, keynote, policy papers on tobacco control. Currently, Mr. Aminul Islam Sujon is working with the National Tobacco Control Cell, and he will be sharing experiences from Bangladesh, very innovative experience from Bangladesh on tobacco taxation and tobacco vendor licensing. So, Mr. Sujan, so we would request
Yes.
you to share these two things in allocated time. And what is your advice? What is your suggestion for India? Over to you. Thank you.
Thank you, Ranaji. I am actually also representing Mr. Mahabubul Alam. He is not here today. His cousin is dead. So, my presentation is in two parts. First part is tobacco taxation, and the second part is tobacco vendor licensing. Please, next slide. A brief, Bangladesh has a dual burden, both tobacco cultivation and consumption is high. There are some photographs of tobacco products and cultivation process. And then next, uh, am- among 15 years and above, 37.8 million, 3.78 crore adults, that is 35.3% adults are using any types of tobacco products. And among them, next please, among them, 1 point, more than 1.9 crore adults are smokers. There are few, only less than 1% female smoker, but male smoker is 36%. And but the smokeless tobacco products using prevalent is quite high. Next, please. The 22 million adults are using any type of smokeless tobacco products. Next, please. Nearly 7% students, 13 to 15 years old, are using any types of tobacco, and more than 161,000 people die due to tobacco-related illness, and including 61,000 children suffering for disease due to secondhand smoke. And 30% of total deforestation attributed to tobacco cultivation in Bangladesh. The treatment cost of tobacco disease is a burden for affected individual and their family, as well as severe burden for national economy. Tobacco cultivation is imposing possible threat to food security, and overall economic cost due to tobacco use were 305 billion Bangladeshi taka, that is equivalent to 3.6 billion USD in 2017 and 18 financial year, and that is that 1.4% of total GDP. And in the same financial year, the government collected revenue from 228 billion BDT from all tobacco products. That means that tobacco is economically harmful for us. Next, please. So the taxation part, the part one of the presentation, taxation, the current tax structure for the smokeless tobacco products is there is a Jorda and Gul. These two type of products are under the tax burden. The 10 gram of any Jorda packs is base price is 40 taka. That includes supplementary duty 55%, VAT 15%, 1% health development surcharge, and the total tax share is 71%. For bull it is also almost same, but base price is 20 taka, and the other percentage of taxes are similar. Tax burden is also similar. Next, please. The cigarette, it is one of the complex tax system in Bangladesh. It is tire based. There is 4 tires: low, medium, high, and premium. And the lower tier, that is the base price is 39 plus 39 BDT Bangladeshi taka. That includes supplementary duty 57%, VAT 15%, 1% health development surcharge, and total tax share in the retail price is 73%. The medium is 63, and the supplementary duty is increased 65%, VAT 15, 1% health development surcharge, and total tax share is 81%. And high premium is also the tax burden is same, but base price is different. Base price for high tire is 97 plus, and premium for premium brand 128 plus. There is a problem in the structure is the base price. Although you might see that the total tax share in Bangladesh is quite high, but the base due to the base price, ultimately the proportionate of the profit is going to the industry's pocket. Next, please. The BD products taxation is also a tier system. There is two types of BD is available, without filter, with filter. Although without filter BD is mostly popular, there is a 3 tier for without filter stick BD, 25 sticks pack, 12 sticks pack, 8 sticks pack. And for 25 sticks, it is retail base price is 18 taka. Supplementary duty is 30%, VAT is 15%, and development surcharge is 1%, and total tax share is 46%. It is the tax burden is similar for 12 sticks and 8 sticks. Only difference is the base price. With filter, the 20 sticks base price is 19 taka. That includes 40% supplementary duty, and all other ratio is like VAT 15%, one development health development surcharge is 1%, and total tax share is 56%. For 10 stick, it is also same. The tax burden is also same. Only the base price is 10 taka. Next, please. So the major weakness and the tobacco taxation in Bangladesh is like it is a complex and tier-based tax structure for bidi and cigarettes, and the low price base in which the taxes are imposed, and the low price base is factor for consumption. Like for example, 72% cigarette consumed from the low tier segment. And tier base also causes to tax evasion by showing upper band into the lower segment. And there is no specific tax in Bangladesh currently, and there is no tobacco tax policy at present. Next, please. But there is one good thing that I would like to share, the health development surcharge. I think this is one of the most important for the sustainable tobacco control in any country. So anti-tobacco organizations, including the BI grantees under the working Bloomberg initiative, are working for long. Even I think that anti-tobacco organizations, since FCTC is ratified, they demanded for sustainable financing on tobacco control. And finally, the government imposed 1% health development surcharge from 2014 and 15 financial year. And then BI grantees, anti-tobacco organizations have worked with the National Tobacco Control Cell to develop a policy to utilize their health development surcharge collected from the tobacco products. Draft policy formulated by collaboration with the TCC, and then anti-tobacco organization also organized capacity building workshops, continue policy media advocacy oriented public support campaigns across the country to pass health development surcharge management policy, and finally it is passed in 2017. Next, please. There are some photographs of NGOs working on the to passage of the health development surcharge policy that includes capacity building, public support campaign, media advocacy. Next, please. The policy advocacy, like health development surcharge issue, was highlighted in the South Asian Speaker Summit in 2016. The Honorable Prime Minister of Bangladesh declared that Bangladesh would be tobacco-free by 2040. And in the declaration, she also mentioned to utilize for tobacco control program, and also a delegation made Honorable Prime Minister. Next, please. There are a number of sensitization events organized by the anti-tobacco organizations. Please, next, please. Cabinet approved it in 2017, and that includes that provided guidelines how to utilize the money will be utilized collected from tobacco products. Next, please. So next, please. The vendor licensing now in tobacco can be sold anywhere, market, in front of hospital, in front of education institute, childcare. So there is no regulation. But one of the local government act that has mentioned that uh, in section 50 and schedule 2 that protect public health interest is mentioned. So under that act, it can be implemented. There is some example. Next, please. Uh, we know that the importance of vendor license is actually it can be minimized easily availability of tobacco products. It can control random selling of tobacco products. It can regulate tobacco companies' marketing and promotions. Next, please. Maybe 1 minute more, please. Next, please. Uh, uh, Under the Bloomberg initiative, the union supported Aid Foundation, a model. They have conducted a model project in which they got many success. Next, please. They organized different kind of events, and they had a lot of findings that include they surveyed in the 18 municipalities and 5 city corporations, and they found that there is no licensing system. But the tobacco seller themselves, they wanted a license for doing their business. Next, please. So there are some progress that the many ward commissioner councillors, they even endorse the issues of introducing licensing. Member of parliaments and chairman of Jila Parishad, District Tobacco Control Law Implementation Task Force Committee also recommended municipalities have introduced tobacco trade license system in their jurisdiction. Especially 2 municipalities already implemented this decision. Next, please. This is my final slide. So my final remarks for tobacco tax is in Bangladesh, tax policy is must. Simple tax structure is important. A specific tax should be in place. BI grantee like Bureau of Economic Research is working to develop a draft tobacco tax policy. National Board of Revenue also received BI grants to work on tobacco tax. So I hope that in coming days, the tobacco tax system will be more upgraded and tax policy will be in place. For vendor licensing, several local government bodies introduced vendor licensing. Local government divisions approved a guideline for tobacco control that includes license issue. Though it is not implemented yet, the government of Bangladesh also initiated for further amendment of existing tobacco control law, in which the NGOs via grantees provided recommendation for tobacco licensing, utilizing tobacco licensing for the selling points. So that is my presentation. Thank you for your patience and hearing. Yes, sir.
Thank you, Mr. Sujon, for coming up at a very short notice when Mr. Tahin could not attend. So really, we highly appreciate your presence. So we also hope that while you are working at National Tobacco Control Cell in Ministry of Health, so we would have more such innovative initiative. So 2 things which you shared that is also very crucial for other neighboring countries when 1% surcharge on tobacco products has been levied and a health development surcharge policy has been passed in 2017 that how we can use this money for various health initiative, including tobacco control. So it's a good thing that money is being used for strengthening National Tobacco Control Cell and also for developing and designing a dedicated national tobacco control program. So I think this is good experience which other countries can learn how to fund their tobacco control programs. So thank you very much.